We've got lots of calls in. We've got a stack here, and before I even got to read another one, Robert is on the line. So let's go to you, Robert. What's your question for our doctors tonight?
Yes, I have a 20-year-old son who plays a lot of guitar, and he's been playing for about 8 years, and then just recently, with his fretting hand, the left hand, he's complaining about it cramping up quite frequently. And just wondering, is there any exercises or anything that he can take to help with that pain?
Good question.
That's a great question, and it goes to show that you don't have to play soccer or cross country to have a sports medicine injury. The answer is stretching is very important, and again, whether you're a musician or an athlete or a laborer, the stretching is vital. And so we really suggest anybody who does repetitive motions over and over again to stretch all the muscle groups within that limb. So for him, stretching the forearm muscles, stretching the upper arm muscles, icing after he plays. There are some kind of peculiar things that can occur, compartment syndromes in patients who do these repetitive motions. If a certain compartment or a fascial plane gets too tight, it can cut off blood flow or it can irritate the nerves to that area. And so if stretching and icing doesn't help your son, I would suggest getting that evaluated to see if potentially there is a compartment syndrome going on there.
Okay. We're going to take one more call before we head to a break. Right now we want to hear from Larry. Larry, you're watching Docs on Call. What's your question?
Yes, I'm 65, and I'm a bicycle rider. I ride probably close to 3,000 miles a year. I ride a recumbent bicycle, and I've been experiencing probably over the last maybe 2 or 3 years the T-band on my right side, at least that's what it's been diagnosed as, down over the right hip that has been irritated and inflamed, and it simply, doesn't seem to get better. I've had a couple of injections in there. It's not constant pain, so it's just annoying that I can't walk or whatever. But obviously, if I sit and driving a car or whatever, then I'm getting up and I'm limping and walking, side to side until things loosen up a little bit. But I'm wondering and I've done exercises with it. I've done stretching. I've tried to roll on a softer type thing to stretch it out. Those things seem to help, but nothing seems to help for a long period of time.
So it's a short-time fix for him, and I'm looking for a long-term fix. What do you suggest?
The IT band's kind of a peculiar thing in that it attaches at the hip and at the knee, and a lot of patients can experience pain at either site or somewhere down their thigh because of irritation there. As it goes kind of over the hip bone on the hip side, there is a bursa sac, a little sac of fluid that can get inflamed. It can radiate that pain down there. I'm imagining that's what has been injected in the past. In rare cases where we can't get this better with things like injections, physical therapy, icing, anti-inflammatory medications, rarely they will go in and remove that bursa sac. However, I'm not implying that you don't necessarily need surgery. Sometimes just being very diligent and persistent with some of that stretching that you said does help. Time is a great healer of a lot of things.
And you can't stretch too much.
Absolutely.
No such thing.
That's the truth. All right. Good evening. You're watching Docs on Call. What's your question for us?
Yes, my question is, I've had a massage therapist tell me that my one hip bone is 2.5 inches higher than my other hip bone, and I've been having a problem with the hip, and because of that, I wondered if I had an injury 12 years ago where I broke my leg and my knee, and she said that because I've been favoring that knee and that leg is why my hip has raised the way it has. And I was wondering what I should do to try and correct that. She said I should try and use that leg more so than the other leg to compensate for that. My question is, do I need to have medical therapy to do that, or is this a normal thing?
It's not uncommon to get leg length discrepancies. People can be born with leg length discrepancies, where one leg is longer or shorter than the other. People can get those, as Ron experienced after an injury. There are several techniques that people can use to kind of get that back into a functional or more normal hip structure. Physical therapy, always very important. Manipulation from either chiropractic medicine or osteopathic medicine can sometimes help with that. Some people who have a leg length discrepancy that can't be fixed, we can put orthotics in the shoe, shoe lifts, those kinds of things to help make more of a functional equality between the two legs, and sometimes can relieve some of that pain.
All right, very good. We've got Jamie on the line now. Let's hear what Jamie has to say. Thanks for watching Docs on Call. What's your question?
I have a question. My 40-year-old husband, whenever he eats, he has a situation where it sounds like he's kind of coughing, but it's kind of a choking sound, and I think he should see a doctor for it. And it happens nearly every time he eats. What do you think?
I agree with you. Have him see your family doctor.
Listen to your wife. That's right. Take care of yourself. All right. Thanks for the question, Jamie. And I'm sure that you guys hear spouses come in all the time saying, God, come on. I've been telling him he needs to get this checked out, or she's really doing this. Help me out here. And you got to kind of play the middleman or woman in that situation, don't you?
Absolutely.
All right. Dan was called in with this question, experiencing some numbness down the leg and some severe pain, nerve and back. What can he do? It's just the notes that I see real quickly.
You know, again, like we talked about earlier, nerve pain down the leg is indicative of a problem at the back, and seeing your physician is very important. There are medications that can help with that. There are exercises that can be done for that. Not every person who has low back pain or has symptoms down their leg needs surgery, and that's where we like to start with that primary care. So he should probably see his doctor about that back pain.
All right. Let's hear what Irvin has to say. Irvin, thanks for watching Docs on Call. What's your question?
Hi, I'm 60 years old, and I have osteoarthritis throughout my body, degenerative disc disease in my lower spine and in my cervical spine. And I'm not able to get any type of exercise anymore. I used to run a lot. I've always been very physically active, and now I get absolutely no cardiovascular exercise. And I had a stress test that took 6 minutes. So, it's that type of thing. How can I get some cardiovascular exercise?
That's a really good question, Irvin. There are lots of different ways to get cardiovascular exercise. A lot of us think walking, running, biking, a lot more of the high-impact things, but actually swimming is a wonderful way to get some great exercise. And because you're in the water, the buoyancy of the water will help support some of your weight and take some of the pressure off any of those arthritic joints that you do have. There are several areas in town. I believe the Easter Seals has a arthritis water aerobics program, as do many of the gyms. They have heated pools as well that also helps alleviate some of that discomfort when folks get in the pool. So that would be a great way to do that.
Riding a recumbent bike, we call her earlier, who rides a recumbent bike. Excellent way to get some exercise. Without having the impact of the running and the walking and those kinds of things, as Jill said, there's lots of ways to stay active and keep your heart and your lungs healthy.
We've got time for one more quick call, and then we've got some final thoughts. Barbara, you're on the air with Docs on Call. What's your question?
I have a question. I had celiac surgery probably in April, and I've been having a lot of trouble, and they had surgery, and I have another one, calcium buildup on my heel, so they took that off. So my other heel got another calcium buildup. Is there anything besides surgery that I could do? I don't want to do the surgery all over again.
Yeah.
Sure.
Trouble with the last one.
There are inserts for your shoes, injections, stretching and icing. Again, we kind of keep going back to that. But there are lots of things that you can try before surgery that can have really been helpful for a lot of people. I think if you want to talk to your foot specialist, talk to your primary doctor, come see us at Sports Medicine Clinic. Lots of options before surgery to keep people, whether it's a foot injury, a knee injury, whatever the case may be.
All right, Barbara, thanks for the question. do want to ask you guys about, and I've looked through this list, and we've got a long stack of questions, and they'll try to get to your questions online later. But how about heat-related injuries? Nowadays, we've got kids training for football, cross-country, soccer this season, and we want them to be safe. What's your number one advice to mom and dad?
Stay hydrated.
Absolutely.
You want to start in the days even before practices start. You want to start keeping your fluid stores up. Water, Gatorades, whatever the case may be, just drinking lots of fluids before. And coaches that are watching tonight, we just ask you, when it's super hot out, make sure you're giving the water breaks. Make sure you're getting them some shade, ice towels, those kinds of things. We can't be too safe about these things.
Absolutely. That's right. All right. Well, thanks for joining us tonight. We found it very informative, and by the stack of questions that we haven't had a chance to get to, we know that folks at home were really paying attention. And again, you can go to mymethodist.net to get some of your questions answered. And we want to say thank you again to Dr. Miles and Dr. Wirth for being here to answer our questions. We appreciate it.
Thank you very much.
And thank you at home for watching Docs on Call. We'll see you again here in a couple of weeks. I'm Gina Morse. Have a great night.